Right now, we have a lot of things happening on in our community. We have shootings that happen in our community, but we have no trauma center. We have a lot of our women giving birth and having prenatal issues, but we have no OBGYN services here.
A woman who was giving birth but couldn't deliver her baby here and had to go to the other side of the city, and the baby died en route.
It takes time for the transfer to take place, and time is a life.
And we are in a healthcare crisis in this community.
We have a lot of behavioral issues that is happening in our community, whether they be drug-related or non-drug related.
Substance abuse, mental health issues, the proliferation of weapons. I would think a full-service hospital would be mandatory, that the city would be totally negligent in its civic responsibilities to have these kind of things going on and not have a full-service hospital here, fully staffed and funded.
I remember Cafris Hospital. We had all the services at that time.
We were actually shock trauma. We had a helicopter pad, which was at the door of the emergency room.
It was ENT, surgery, cardiology, neurology, recovery room, ED, pediatrics. We were a full-service hospital.
We're living in a district right now that has two different worlds based on income. And if there's any sense of fairness and a desire for equity, then we need to make sure institutions like hospital reflect the same whatever neighborhood you're in.
This is the last hospital that we have to help our residents who can't make it cross west of the town. UMC provides that. That is the only health option that we have here, and we're not going to let it just crumble up or go anywhere because the council members won't have a vote of integrity to keep a hospital east of the river.
This is about health justice, and this is about health justice for people who live in Ward 7 and Ward 8.
You don't ask other communities, particularly the more affluent communities, to make those kind of sacrifices. So why should we?
This is a city with a lot of money, and in fact, there are lots of ways to find the money that we need. Any elected official who says, oh, I'd love to help United Medical Center, but I just can't find the money, we're not going to accept that, right? Because we know there's money. So let me just give you a few examples. We have a growing surplus in our convention center fund that is not needed for anything else, $100 million. We could tap that to pay for this hospital. The city has corporate tax subsidies that we know are not producing any new jobs or bringing new businesses to the city. We could get rid of those wasteful subsidies and use that money instead to save this hospital. Should we take away those corporate subsidies and put it in this hospital? Yeah. Absolutely. So those are two examples of where there's money just sitting there. Our policymakers know it's there. We need to tell them to put it in the right place, not the wrong place.
And I'm hoping that you're going to join this effort. Are you going to join this effort?
September, we need to raise a campaign between now and September on for the rest of the year, asking to fully fund United Medical Center.
It'll take every single resident here in Ward 8 and in Ward 7 standing up to their own elected officials and telling them to put their money where their mouth is when they want your vote, to start telling them to vote for better funds for UMC Hospital, which is the only option that we have here as far as health for east of the river. That's what it'll take.